When you hear those words, you have cancer, your world starts spinning fast and you try to grasp onto something. It could be spiritual, it could be physical, but you try to understand what that diagnosis means to you.
The purpose of yearly screening mammograms is to detect breast cancer at an early age. This ensures more effective treatment and high survival rates.
I decided to get a mammogram for myself for early prevention. I have a family history of breast cancer, and because of that, I wanted to make sure that I was screened early.
Initially, I had gone to another hospital for mammograms, and when Lawrence General introduced the 3D mammography, I was encouraged to have my mammograms here, and it was a very positive experience. It wasn't painful at all. They're just so discreet and so efficient and so kind. It's always been a positive experience.
I felt supported. I felt that I was seen. I was not only a patient. I was a human, a mom, a person with value.
Had the services not been available locally, I honestly can say I would not have been as proactive as I am with my preventative screenings. The parking across the street is free, and the South Pavilion is on the ground floor, so it's so accessible and so convenient. You get the same quality services here at Lawrence General, and you don't have to drive to Boston, you don't have to sit in traffic, and you don't have to pay to park.
Having access to healthcare here close to home was important. It meant I didn't have to take an entire day out of my schedule, and if I had to have follow-up services, it was easy to get there.
A lot of patients don't get screened because they have this idea in their head that it might take too long, they don't speak English, they feel like they're exposed, it's painful, or sometimes they're afraid of just the finding.
My main concern initially was modesty. They bring you into a private locker room, you get dressed in a Johnny, immediately escort you into the exam room. The staff were just so kind, and even the ambiance in the room is just warm and quiet, and they just put you at ease.
One of my main concerns was the pain. Was it going to hurt? The team here at Lawrence General really helped me by taking some time talking to me, answering the questions that I had. It really helped to alleviate those nerves.
When I make my annual mammogram appointment, I feel good that I'm taking care of myself preventatively, and there's no greater feeling than getting that report that you do not have breast cancer.
Early detection saved my life. And early detection saved the lives of so many women. So we need to be proactive.
Because of that early screening, I was able to discover that I did have cancer. And I can only imagine what would have happened had I waited. Even if you're nervous about going in for mammography, and you've heard that it could hurt, it could pinch, it's a little uncomfortable. Yes, it is. But it's important, because in the end, it can save your life.